important root causes as to why someone might present with a major depressive disorder. In other words, in conventional medicine, we look at psychosocial and physical stressors, and we may look at genetics, and we therefore might apply a psychoactive drug or a pharmaceutical to make a difference. But what psychiatry is beginning to look at is everything I just talked about. Inflammation, oxidative stress, dysfunction in the cell part called mitochondria, dysregulation in adrenal function, so the hypothalamic pituitary adrenal axis, changes in epigenetics, and the impact that that has on damage to cellular components and inhibiting the growth of nerve cells and limiting the survival of nerve cells. Because what they found is, and they're trying to understand, is why are patients not staying stable on their meds? Where's the treatment resistance coming from? Why are patients more vulnerable to further episodes? And also, what are these episodes doing to the structure of the brain? And how is it that we can prevent further decline in not only the function, but the structural abnormalities that occur with each subsequent episode? And so when I put together a scheme many years ago about how I want to approach an individual case, I had to think of things in terms of one step building on another, work through the web of how the body's functioning and all the different stresses and different areas that you can make an impact. So I start at the bottom with gut and liver support and detoxification and work my way through trying to reduce oxidative stress as much as possible, understanding that when you get on top of those two things, you begin to have a positive impact on how the immune system is functioning and the extent to which you can control inflammation in the body. And so we talk on the first level about diet therapy. And we talk also about supporting the gut and the liver, as I mentioned. And we try to correct dysbiosis. That's a common scheme that I use to treat most chronic illness, whether it's kids or adults, whether it's inflammation in the joints or inflammation in the brain. It's talking about sort of root causes and the origins of dis-ease. We talk about supporting glutathione, which is an incredibly important antioxidant for neutralizing the effects of toxins, chemicals, metals that drive oxidative stress. And we'll talk about mitochondrial dysfunction as well.